So today we are going to go through the final exam review. And then after the final exam review, that's really it. What you guys are responsible for now, okay, of course you have your final exam, which is going to open today, okay? And then you have the rest of your projects. Remember, we extended the due date. So Friday is the last day. You have to get it in by Friday, okay? No exceptions at all. Friday is 100% the last day. The final exam, the last day to take the final exam will be Saturday, okay? And I don't know if you guys have noticed, but we also have a makeup work tab or link or whatever you call it in the activity section on Blackboard. So this is to allow you guys, if you need to make up any of your assignments that you missed throughout the quarter. Okay, of course, for half credit. The rule about this is, yes, the assignments are all open, but do not submit any assignments in the original assignment submission links. Okay, only submit your assignments in the makeup work link. I'm not looking at any of those old links anymore. Okay, we're only focusing on the new one, the new makeup work submission link that I put there. That's the only thing that will count if you're going to submit your assignments. Okay, if you're going to submit your makeup work. All right, so don't make that mistake and submit them into one of the old assignment links, because it's never going to be looked at. I won't see it. Okay, so just letting you guys know, do not submit them there. Submit it in the makeup work section, makeup work link. And of course, that will also be due Saturday. So that is what you have to look forward to for the rest of this week, for the rest of the quarter. Other than that, please everyone check your grades. Make sure that everything is accounted for. We don't want there to be any kind of discrepancies or anything like that, because if I had to fix something, your last day to ask me or to get anything fixed would be Saturday. Okay? After Saturday, it's 100% whatever your grade is, that is it. All right? So if you had anything missing or something that I didn't count or whatever, oh well. Okay, so make sure you guys check your grades now. Make sure that everything is accounted for. Make sure there are no mistakes. And if there are, you have to tell me now within the next few days, because when Saturday comes around, no more fixing. All right, so your grades will be as is. Okay, no exceptions, because grades are going to be turned in the next day. Or maybe Monday, just depends on how long it takes to grade your guys' research papers. Okay, so that is what you guys need to be working on in the next few days. Okay, so we have the makeup work if you have it. If you don't, that's fine. And then we have the final exam, and we have your research papers, which are going to be due Friday, not Saturday. All right, and then other than that, check your grades. Make sure everything is good, is what it should be. Okay, I think that's really it. So if you guys have any questions, please let me know right now. Otherwise, we can start the review. Okay, so anything? No, nothing? All right, that's fine. I'll go ahead and share my screen and we'll start the review. There are 100 questions. Yeah, so there are 100 questions. We're going to be here for a while. Of course, answer them as fast as you will. It just really depends on how quickly you answer the questions. That's it. But pretty much it's going to be the same rules as we usually do. So use your ID number as your nickname, and the top 5 will get extra credit. Okay. All right. Very good. Okay, so the countries that have the social health system, England and Canada, no. England and Canada have a national health system, all right? So the countries that we talked about, that we mentioned, that have the social health system were Germany, Japan, I believe we said Australia, but if we didn't, that's fine. Germany and Japan, yes. All right, definitely not the United States. All right. Very good. Okay. So ignore this one because it's kind of messed up the way that it's set up on Kahoot. But you guys need to know that incidence is the new cases that show up divided by the population that is at risk throughout a specific period in time. Okay. It's not the total population or anything like that. It's the population that's at risk, okay, of getting it. The people at risk could be the total population, but it just really depends on the situation, okay? Perfect. Okay, so in a single payer system, okay, that's a country so like the UK, Canada, even Japan, Germany, all of that, right? Those countries that have a single payer system, the primary payer, the entity that pays for everyone's health care, is it an insurance company? Or do you think it might be the government? It's definitely not an insurance company, guys. It's usually always the government. Okay. All right, great. Okay, so tertiary prevention, that is, let's say you already have a disease, okay, already had nothing you can do about that, but we still need to try to prevent any further injury or progressing this illness or allowing any other type of illness to spring out of this illness. Okay, so a lot of things that you can do with tertiary prevention might be like, let's say you had surgery because you have a terrible disease. So you had surgery in a hospital. When a tertiary prevention in that situation would be, doing things that prevent infection. Okay, sometimes when you're in the hospital and you had major surgery for whatever disease you have, you are still at risk for infection. Okay, so doing things to prevent infection can be tertiary prevention. Okay. Very good. Okay, so Medicaid, guys. Medicaid. You guys should know this, actually. Medicaid and Medicare have been like the cornerstones of this whole course. These are the two major public health insurances that we have, okay? And Medicaid is the one that is passed on to the states, that the states get to regulate, and that the way you can qualify to have that one is income eligibility. So low income, it really depends on what the states require, like how low income you need to be to qualify for Medicaid, but eligibility is based on income. Okay, so low income for Medicaid. For Medicare, that is going to be 65 and older, end-stage renal disease, also disability. Okay, so don't forget that. This is one of the biggest purposes of this class. Okay. Very good. Okay. Forget this one. I don't like this question. Yeah, so holistic health adds in the last element to health, which is spirituality. Any other definition of health, they don't really include spirituality, but they will include physical health, mental health, emotional health. Spiritual health is another dimension of health or another element of health that holistic health cares about. Okay, but normally other definitions, other organizations and whatnot, they don't really include that. So that's why that's a little bit significant, although I don't really like the question. Okay, so initially, what was the main purpose of private health insurance in the United States? Well, the very first private health insurance that happened in the United States was it was workers' comp. Okay, so workers' compensation, and really all workers' compensation didn't pay for medical services at all. What workers' compensation did was help compensate you a little bit for the loss of income while you were sick. Okay. again. Very nice. All right. Okay, so these small variations are these areas that show up in the United States, and they are using an abnormal amount of resources. Okay, so healthcare is extra expensive in certain random areas of this country. And the thing is, there's no explanation for why that is, because those areas do not have extremely healthy people, nor do they have people who have more diseases than the rest of the country. Okay, so the demographics and everything are pretty much consistent throughout the country, or with respect to like the healthcare and whatnot. But in those particular areas, there's just a lot of healthcare resource usage, a lot of utilization, and a lot of money just going towards healthcare. And there's really no actual explanation. It's not like, because given whatever demographics they have, whatever health status that they have in these areas, if you compare them to the rest of the country or areas in the country that are similar, they don't match up at all. So they're just weird. They're just weird variations in health practice. There's a lot of waste going on clearly in these areas, and that's what that is. Okay. Yes. All right. Yes. Okay. So moral hazard results directly from health insurance coverage. It's not inadequate to providers and not, the uninsured status of a segment of the population. That would have absolutely nothing to do with it. So moral hazard happens, okay, when it springs out of the flaws in the traditional health insurance, okay, traditional private health insurance, right? Because private health insurance was that traditional indemnity way of insurance, and how they pay for services to the physicians is really they don't regulate anything. Okay, they don't regulate utilization or anything like that. There's no checks. They don't care about referrals or anything. What they do is they allow the physician to write an itemized bill. Okay, here's all the stuff, all the different things that I did for this patient. And then they pass it along to the insurance company, and the insurance company goes, cool, here's your check. There's your payment. Okay, so there's really in this whole process, there's no one's really checking the diagnosis. No one's really looking at this and going, is this really warranted? Is it really necessary to do for this patient? Are you doing too much? Are you doing things that don't even have anything to do with the diagnosis? Okay. So in this type of a situation, because of health insurance coverage, and it really insulates the patient and the provider and everyone, so the provider feels very comfortable. The provider can really give any kind of, in this situation, the provider can give any kind of tests, treatments, whatever, to the patient, whether it's required or it's needed or not. And the patient, of course, is not going to check it because the patient, is going to blindly believe the physician. Okay. So the physician can take advantage and exploit that patient, get as much money as it can out of that patient, give them as many treatments, tests, whatever, and then pass it on to the insurance company, who is not going to check anything. Okay. And the insurance company is just going to go, oh, okay, here you go. Here's the money. All right. So in that instance, okay, that is moral hazard. Exploitation of the patient, squeezing as much money as you can, wasting a bunch of resources just to get more money out of the insurance company, by providing care for the patient. That's what that is. Okay. So moral hazard results directly from insurance coverage. It results directly from provider-induced demand. Okay. There. Okay, so the technological imperative is, you can think of that as like the drive that Americans have to push them to invent more and to get more out of medical technology. But the expectation that we have for what medical technology can do for us comes from our cultural beliefs, okay? So prospective utilization in managed care, this is where the this is the utilization portion that happens before care is even provided. Okay, so let's say you have the physician thinks that you need a surgery for something, and they have to go get it approved by the managed care organization. And so this is where prospective utilization review happens. They review the case and they go, okay, yes, you're right, this patient needs surgery. Let's approve the surgery. Okay, so this is the review that happens before the treatment actually starts. Okay, so fee schedule is what is used, okay, by managed care organizations, and also it's the same method and that's used by private insurance, okay, when they use the fee-for-service system, okay, it's the same thing when they use a discounted fee-for-service system in managed care, okay, they also use the same fee schedule. It's just discounted. Very good. Okay, so PPS, that stands for Prospective Payment System. That's the payment system that Medicare switched over to after Cost Plus. Okay. Okay. You guys remember what interoperable means? What does it mean? You're gonna have to know this. What does interoperable mean? Come on, someone has to know.
Oh, where like computer systems or softwares are able to exchange and make use of their information.
Did you say that it's like a network that allows people to share information?
Yeah.
Oh yeah, exactly. That's what that is. So it's a network that allows physicians, pharmacists, hospitals, whoever is part of the healthcare team, okay, allows them to view information of a patient and also to make changes where relevant, whatever. This is so that they're all seeing the same thing and so that they're all able to coordinate the care appropriately instead of just sending faxes or whatever the heck they do still. Okay. All right. It was definitely not Obama, you guys. No, Obama did not do this. This was happening. National health insurance was a thing that people were talking about almost 100 years ago. Okay. And Truman actually came up with a real proposal. Okay, so this was in the 40s. Okay, so physicians back in the old days they did not want, the reason why they did not want to be part of a corporate setting is because they don't want to be part of a salary arrangement. Remember, they want to be entrepreneurs. Okay, entrepreneurs do not work for other people. They work for themselves. Thank you. Thank you. Okay. Oh, it's fine. You guys. Good. Because community hospitals are everywhere. Almost every hospital that you know is probably a community hospital, and it's also probably a private, not-for-profit hospital, because those are mostly all of the hospitals in this country. Okay. Yeah, it's a managed care organization program. Okay, so let's go and stop sharing. Do we have any questions? Anything? Nothing? Okay, nothing. You guys know what's expected of you, so go ahead and do it. All right.